COVID. We have to be able to hold the line until the vaccines arrive. And speaking of which, here's today's big hard fact. Nigeria has taken delivery of 0 COVID-19 vaccines so far. So in the midst of all the disputes, the controversy, the back and forth, the big number on the board is still 0. Yes, we have commitments for vaccines, and those vaccines will arrive eventually. Some of them may be as early as this month. But let us not lose sight of the fact that right now, any Nigerian who has been vaccinated did so abroad. So now we have to talk about the practical steps being taken to get vaccines into the country. We have to talk dates and timelines. We have to talk numbers. We have to talk about the obstacles. And we have to talk about WHO, and we also have to talk about who is going to administer the vaccines. But apart from all of that, there's a whole lot that needs to be done to keep Nigerians alive until the vaccines get here. And we're going to be talking about some of those things today. We're going to talk about oxygen availability. We're going to talk about compliance to safety rules and what government is doing to improve them. Because as you know, lots of Nigerians are still doing anyhow. So these are all the things that we're going to be talking about for the rest of the hour. But let's start with vaccines. I'm Sandra Ezekwesili, like I said, but there's a quarrel currently happening between COVID and BUA over vaccines. You heard that on the headlines at 5 o'clock. Yesterday, BUA announced that they'd paid for 1 million vaccines to be delivered to Nigerians. The vaccines were coming from the African Union through COVID. They thanked COVID and the CBN Governor Emefiele, for helping them to make it happen. But then COVID came out to contradict BUA. And they said no private company is able to acquire vaccines on their own. They said it was COVID as a group that was working on getting over 40 million vaccines from a Frexim Bank and the AU, not BUA. And they also said a down payment has been made. Now, one would think that it would end there, but BUA came out swinging in a press statement. They insisted that they alone brought out money for the down payment. According to them, AU gave yesterday as the deadline for paying for the first 1 million doses, about $3.4 million for that first 1 million doses. And they say that nobody else in COVID was ready to bring out the money yesterday. So BUA did. They also attached documents proving that they transferred that money to COVID. And BUA says all this drama is happening because another COVID member, a big business person, is embarrassed that BUA is getting glory for bringing the money when they couldn't or wouldn't. Now, I've been hearing from a lot of Nigerians since this story broke, and the most common reaction appears to be shock and annoyance. Many Nigerians are saying that they don't understand why the members of COVID are even arguing about this. Why has deciding who gets the glory become such a big deal? Some are worried about what happens next. They're saying that if COVID members are already fighting for glory before the first 1 million vaccines have been delivered, how sure are we that everything will run smoothly for the remaining 40 million or so? Will COVID members be able to put their differences and their animosity and their personal feelings aside and work together to ensure that these 40 million plus vaccines are secured? And of course, as people talk about this COVID controversy, that also brings up the previous controversy from relief materials. Remember that in so many stories, and in so many states, COVID relief materials ended up stuck in warehouses. So the big question is, can COVID get past this interpersonal problem they seem to have and rise to the occasion? What do you think about this dispute? Have you been following it on social media? Because it's been very public online. What do you think about the dispute among the members of COVID over whether or not BUA paid for these vaccines? 0700 993 993 993 080 959 75805. That's for WhatsApp. So you want to send your thoughts to us via WhatsApp. Send us a WhatsApp message 080 959 75805. But call the studio number 0700 993 993 993. What do you think about this squabble among the members of COVID over whether or not BUA paid for these vaccines? 99.3. Hello.
Yeah, good afternoon.
Good afternoon.
Ezekwesili.
Good to have you on the show. Hello? Oh no. What just happened? Sorry about that. Call back if you can. Hello?
Good afternoon.
Good afternoon.
Good evening, Auntie Sandra.
Good evening. Welcome.
How you doing?
I did. Got me welcome.
Neighbor talk.
Ebuka, welcome. Go ahead.
Yes, okay. Just like I was listening to some guys, okay, Arise News, they were analyzing this very thing. You know, one of the presenters said, why is this guy showing ego? They was not on your how did he even put okay, come on, yes. Why is it like this? We are talking about life and death. You know, we are talking of even the Oyibo guys, the brigade, the Jeff Bezos, so to say, all of them, they are private organization, and they invested money in this very vaccine, right? And the company or the country, so to say, accepted those things. We're talking about survival here. So if the BOA and the car COVID are just going back and forth, or who donated the money, or who paid for the vaccine, who should not pay for it, or if you have the money in the country, okay, during the lockdown, maybe they were contributing money to Lagos, okay, was it the NCDC, right? Even the IMF, all those their names, they were contributing money, they were spending money, right? And they were accepting. Why is it now in this vaccine time? And I just want to carry there, I beg. You know, saying a common man, they just fight themselves. Mr. Chris from Amov, they will say, when the elephant fight, the grass will suffer it. They made a reason this time. They made a child collect the money to give us vaccine. Thank you.
Thank you, Emeka, for calling. Odedei, thank you for calling us. Hello, Odedei, are you there? Oh, no, I'm sorry. Call back if you can. 0700 993 993 993. I told you the BUA announced that they'd paid for 1 million vaccines to be delivered to Nigerians. And the vaccines were coming from the African Union through COVID. They thanked COVID and the CBN governor, Governor Emefiele, for helping them make it happen. And then COVID came out to contradict BUA and said that no private company is able to acquire vaccines on their own. They said it was COVID as a group that was working on getting over 40 million vaccines from Afrexim Bank and the AU, not BUA. And that they also made a down payment. And then BUA came out again and said that alone they brought out the money for the down payment, that they brought out $3.4 million for 1 million doses, that the AU gave yesterday as the deadline for paying for the first million doses, and so that they had to step up and bring out the money because nobody else was stepping up. And it's caused quite the conversation online. And I'm wondering what you think about the dispute going on over whether or not BUA paid for these vaccines. Kayode in Ajao Estate. Hello.
Yeah, Sandra, good afternoon.
Good afternoon. Welcome. Go ahead.
Yeah, actually, if this was a joint project and BUA is coming out to identify what their own action to single out themselves, I think it's not too okay.
Okay.
However, they are all big men. And the competition is good.
Okay.
Do you understand?
Okay.
I think even though we don't want to mention the other big man, I think we somehow know him. We all know him. So if he feels that he wants glory, he should bring out more money. He should say, no. Okay, since you have done this, I want to double what you have done. So let them compete, and at the end of the day, that means more vaccines for the populace. So let them.
How are you doing now?
Hello?
Are they on air?
I don't understand what just happened.
Okay.
Okay, Kayode. Thank you very much for calling us. All right. 99.3. Hello. Hello.
Hello?
Thanks for calling. What's your
good
name?
afternoon.
Good afternoon.
Yeah, my name is from Yaba.
Who?
Ruben.
Ruben. Hi, Ruben. Welcome. Go ahead.
I'm good. Yeah, I think COVID. I think these people are just being arrogant. They just a time will come in this country where I want to buy something and COVID is saying that I have to take approval from them before I buy it. I think that's just what it is.
What? No. What?
I'm saying that it sounds.
I'm trying to understand that analysis. No, I don't understand.
Hello, ma. Are you there?
I'm here. I'm trying to understand the analysis you just shared because you don't follow.
Will come in this where ordinary paracetamol want to buy and COVID will say that I must take approval from them.
Why would they do that?
Because from the analysis I heard from you, it seems COVID is just trying to take glory for another man's way. That's just
okay.
And COVID refused to do something on time. Why saw the loophole, paid for 1 million doses. If they say they want to give the million doses to the Hausa people, it is their dose. It is their dose. It only remains for COVID or whatever the ministry involved to do what they have to do to administer it. If they say it's only Nigeria that they want to give, they can give it to anybody. It is their money that they used to buy. It is not Nigeria's money now.
That's not exactly how it works, because COVID is a coalition of private organizations trying to fight COVID. That's what COVID is. So they can't exactly decide who they want it. It's not that straightforward. But I do understand what you're saying, Ruben. Thank you for calling. Olu Wisdom is on the show. Hello, Olu Wisdom. Welcome.
Good evening.
Good evening. Olu Wisdom? Unfortunately, your line is not very clear, so perhaps call us back if you can. It's 15 minutes past 5. I'm Sandra Ezekwesili, and we're taking a look at how Nigeria is handling the war on COVID. And the first story I brought you is the quarrel between COVID and BUA over vaccines. Because remember, I said that for the next hour, we're going to have a conversation about oxygen availability. We're going to talk about compliance to safety rules, what government is doing to improve them. We're going to talk about practical steps being taken to get vaccines into the country. We're going to have to talk about dates and timelines. All of that is coming up next. But right now, we're talking about the biggest vaccine story in Nigeria. And that's these two big corporations having a go at it over who brought out money to pay for the first 1 million doses of the vaccine. Eze Negbeda, welcome. Hello, Eze. Are you there? All right, then. 99.3. Hello.
Hello, Sandra. Good evening.
Good evening. Thanks for calling.
This is Rita calling from First Step.
Welcome, Rita. Go ahead.
COVID are working on 40 million doses. Meanwhile, they were unable to pay for 1 million. How shall we about the 40 million doses that are still coming?
Good question.
Sandra.
That's a good question, Rita.
Okay. And an individual came out to pay for the 1 million that we are able to administer to people before they die. And they are fighting. So we should continue to die and wait for their own 40 million doses. I bet they should go and sit down and let us rest. Bye-bye.
All right, Rita, thanks for calling. Odede, hello. Thanks for calling us.
Yeah. Good evening.
Good evening. Well done.
Firstly, I want to say the squabble between these two big corporations is an evidence that this philanthropy, so-called philanthropists in Nigeria, are all about the glory that they want to get for doing something. and about what they are going to get from government at the end of the day. They don't do things for altruistic purpose. They are not like Bees and Melinda Gates Foundation that will go to the hands of the world to help out those who are in need without even looking to get anything back. So that is one thing that we need to know about those who make the donations in Nigeria. But I want to say something. I think this talk about getting vaccine for such humongous amounts of money is a misplaced priority to me.
Okay.
Because if we say that we are getting vaccine for billions of naira just to get people vaccinated against, COVID is deadly. Quite right, we know about that. But what about the more challenging situations that Nigerians are facing? If you compare the deaths due to COVID to the deaths in Nigeria today because people cannot afford hospital bills, you will realize that the death due to COVID is insignificant.
Yes, but the death due to people being unable to afford hospital bill is not infectious in the way that the deaths from COVID is.
It's not infectious, right? But no, look at Kogi, for instance, where they have thrown caution to the wind completely. Nobody is doing it, no social distancing, nothing. How many deaths have we recorded from COVID in that place?
You're the one that just said they've thrown caution to the wind. So how will you know? People who have thrown caution to the wind, will they come and tell you, oh, people are dying in our state from COVID?
No, at least the death rate in that state, should have increased considerably. But go to their hospitals there in Kogi State, you will realize that the number of people that are dying on a daily basis because they cannot afford to buy drugs, because they cannot pay for tests, because they cannot pay hospital bills for admission and have to resort to one woman to get a go or the other.
I understand that, but we go back to the initial point that I made. It's not infectious. The thing with COVID and the money they are spending to get vaccines is so that we don't keep reinfecting each other. Because if we keep reinfecting each other, the virus will keep mutating and it will keep getting deadlier. That's why this second wave is worse than the first. And they're projecting that the third wave will be worse than the second because the virus continues to change. So we're not seeing many deaths now, but we don't want to see many deaths now. Or should we wait until we see many deaths and then I say, give us vaccine, give us vaccine, and by then the vaccine is not working again.
I believe, I wouldn't know, maybe it is fate, maybe it is whatever it will be called. I personally believe that the rate of death that we are recording in Nigeria is very low and it will remain so.
Okay. All right.
To me, I believe there are some other priority areas that we could have expended this money on. Very soon, this vaccine will be next to nothing. As in, the price will be almost free. Most nations of the world will be flooded with this vaccine.
Nothing is free. If it's free, somebody is paying for it. All the vaccines we have here that are free, somebody pays for it.
It will come in form of donations. Just like polio vaccines.
But this one too is donation now. This vaccine that is coming is donation, kwa. BUA group donated money. But BUA donated the money to pay now.
BUA, why don't BUA, you put this money into some other most pressing areas.
Is their personal money? Imagine you are spending your personal money on a babe that you like, and somebody else come and tell you, guy, put this money that you are spending here on something else. Won't you say, is it not my babe? Can't I spend money on the babe that I like?
Yeah, I understand what you are trying to
do. Thank you for calling, Jerry. We've been talking for 5 minutes. Jude, are you still there?
George.
George. Sorry to keep you waiting. Welcome.
I'm here.
Yes.
Welcome, my sister.
Live on the show. Go ahead.
Yeah, you can see that this billionaire, these so-called billionaires we have, they are intellectually lazy.
Why?
How can you imagine? Even if we are in a civilized state or a civilized country, that COVID ought to be investigated. Are they not the ones that heal palliatives?
Well, they're not. No, they're not. They're not the one that heed palliative.
They are the one that organized the palliative that looted. Yes.
Yes.
Because their names were written on the bag of rice. And COVID, yes. So this attitude is so shameful and disgusting.
The home of
How can the so-called private sector, they came about, okay, fine, we want to come together and fight this virus. Let's contribute money. And even for you to get 1 million, you are unable to get 1 million. And somebody stood up and said, okay, I'll do this for myself. And you are angry and you are fighting that person because he wants to outshine you. Why must he be you all the time? For humanity's sake, it's zero here in Nigeria. Definitely, you can see that Nigeria is a joke. No. If you watch Cartoon Network, if you watch Cartoon Network, you see that Nigeria is like Cartoon Network.
Nigeria is not Cartoon Network. It's not a joke. Don't do that. Be patriotic. Where's your patriotism? Don't speak like that about your nation. Akinola in Festac. Hello.
Hello, Sandra.
Thanks for calling. Good afternoon.
Yeah, it took like forever. Jeez.
It's probably going to take more because I have just 1 minute before break time and they're going to yank you off once it's 25.
Finally, you picked my call. Anyway, first and foremost, I'd like to suggest this, that you should just peg the calls to 1 minute. Please, 60 seconds is enough for you to do your contribution.
Okay.
Then quick one on the COVID thing. I think Dangote is the chairman of COVID, and these guys made huge money during the lockdown. They practically increased all the prices of their goods and commodities. The BUA, the chairman and all other things that comprise the COVID. They made huge money. And they are getting contracts from government. They are fixing roads. They are getting road contracts that is giving them tax rebates. I mean, how do we benefit from them as Nigerians? And they are still exploiting us. Gosh, I just pray that God will help us in this country because that's the only hope for us. Thank you.
Akinola, thank you very much for calling us. All right, we'll take a quick break. We'll be back. Don't go away, Lagos.
Hello, champions. It's your Deals Plug, and as usual, I've got the best news, and it's just for you. Milo has just introduced a new radio drama series that helps educate mothers and children on life lessons using sports as a metaphor. This series is a story woven around David and his friends in his journey to achieve his dreams and ambitions of going to Spain to play in Barcelona under the tutor of Coach Milo, with different lessons to learn from each episode. It's full of different plots that communicate the great value of sport as a teacher, with Milo as the driving force. So watch out for this series on our station to learn that you can achieve your dreams through determination, discipline, teamwork, honesty, and confidence while you enjoy the nourishing goodness of Milo with its enriching blend of malt, cocoa, and milk. Moms, encourage your children to listen and follow the series for the love of football, all from Milo.
More news and information coming up. We'll be back in a moment. Say you're planning a trip to Dubai, a romantic getaway, business, family vacation, leisure. Let me give you 4 reasons to fly with us at Airpeace. Airpeace flies to Dubai via Sharjah International Airport. And guess what? You get to Dubai city center in 15 minutes. How? Airpeace will get you there in style and class. I mean, talk about limos and cozy saloon cars with no extra cost to you. Let's not forget you spend a much shorter time going through immigration and baggage claim at Sharjah International Airport. You basically get to the city center faster than if you landed in DXB. When you fly Airpeace, you enjoy a much lower airfare like none other in our luxurious Boeing 777 with our hospitable cabin crew. Now tell me again why you wouldn't fly Airpeace. What are you waiting for? Oh yeah, visit www.flyairpeace.com or download our mobile app and allow us to give you the Dubai experience starting with us.
Guy, what's in the make you scatter house like this? I beg, you help me see my Airtel SIM. carry and give Shade yesterday. But you know they use am again now.
Yay! You don't carry my bonus give landlord picking. Now today you go pack out.
On top Airtel SIM?
Yes, so if you don't reach 15 days where you never use your Airtel SIM, go find them now. Because why? Obonga will full on top of. Hey, get 2,000 naira airtime plus extra 200 MB for just 200 naira. The more you recharge, the more you are woofo. To begin enjoy this awoof, just dial *241*7#. Terms and conditions, Joe.
Airtel, the smartphone network.
Hey, Oga and Madam, you don't see the room now. Make I show you the toilet where you go to share with the other neighbors.
Now the toilet be this.
What's the apple?
Oga agent, you mean say na general toilets clean come white like this,
Yes, now. See what's in they use take cleaner and kill the yama germs come out.
Hypo toilet cleaner. Wow.
Wash your toilet at least once a week with Hypo toilet cleaner to keep it sparkling clean and gem free. Available in sachet for 35 naira only. Madam, now 2 years landlord one collect.
We go pay for 6 years.
Running a growing business is not easy. It's all hands on deck for me and my small team of 12. I know that to get the best out of them, their health must be in tip-top shape. But most HMOs I approached said I have to have at least 20 staff before I can get on a plan. They don't cater to small businesses. Then I found Reliance HMO. And just like that, they got my team and I registered seamlessly. What's even mind-blowing is that their rates are flexible and affordable while not compromising on quality care. I have not received any complaints from my team since they got on board. The service is that great. Indeed, you can rely on Reliance HMO for your small businesses and its healthcare needs.
Visit reliancehmo.com/corporate or call 0700-7354-2623 to get a quote for your small business and start enjoying reliable healthcare today. Reliance HMO. You can rely on us.
I won't tell you the secret of better food. Nadi, no chicken and classic seasoning powder. The ingredient they take make am na natural by nature, like real chicken, rosemary, black and white pepper, garlic, onion, parsley, mushroom, coriander. If you knack no seasoning powder for inside your jollof, fried rice, egusi, and all other soup, you go know say flavor pass flavor. No seasoning powder, natural by ingredients. By flavor.
Hey, Ren Money will lend you up to 6 million naira in 24 hours for business or personal needs. So, for loans of up to 6 million naira, visit renmoney.com or call 0700 5500. Call us now. Our phone lines are open till 11 p.m. Mondays to Fridays. Need money? Ren Money.
Yes! Thank you. I love it.
Sorry, ma. Please put your mask back on.
Oh, sorry. It's hard to control my excitement when I get free data to use as I like.
Your mask, ma.
That's right. Get up to 36 gigabytes to use for 6 months when you buy any 2 smartphones of your choice for you and that special someone from any Glow World outlet. But hey, remember to keep your mask on and observe social distancing through your excitement. This smartphone festival offer is exclusive to Glow World stores from the 8th to the 22nd of February 2021.
Unlimited.
Uncle Dentist, what are cavities? And how does Colgate protect my teeth from cavities? Does it use Kung Fu?
No, dear. Most tooth pains are caused by tooth holes called cavities. When you brush daily with Colgate Maximum Cavity Protection, its expert formula locks natural calcium in our teeth and helps protect them from cavities.
It's time to upgrade to the world's most chosen toothpaste, Colgate, because Colgate locks calcium in.
Keeps cavities out!
Colgate is recommended by the Nigerian Dental Association.
It's a new day, a new beginning. As you prepare for the day ahead, just anything is not enough for a delightful, healthy start. Start your day right with Holland your Eva. Taste creamy vitamins and nutrients. Life is so different with you. Holland your Eva.
Hollandia Eva milk, right nutrients for a healthy breakfast.
Sometimes pensions can feel like a football match. You'd love to get in the game and make things happen. Guy, pass the ball, I'm open. But you can't. You have no choice but to sit on the sidelines and watch life happen. If you feel undervalued and unappreciated, then it's time to switch to ARM Pensions. See, At ARM Pensions, we believe in taking action.
Guy, get in the game.
Because when it comes to your retirement goals, you shouldn't be on the sidelines. You should be our star player.
Switch to a team of more than just pension managers. Switch to a team that appreciates you. Switch to ARM Pensions today. ARM Pensions, invested in your tomorrow.
Hey, babe.
Hey, hon. How are you?
I've had a very hectic week and I'm looking to have some fun. Let's go out this weekend.
Where do you want to go?
I want to go to Upbeat Center.
What's that?
It's the first trampoline park in West Africa. They have trampolines, wall climbing, foam pit, dodgeball, video games, and sports such as football, basketball, and volleyball. And do you know the best part? They have a great waterside restaurant where we can eat and chill when we're done.
That sounds like fun. Let me call Peter and Omotaya so we can all go as a group.
I can't wait.
That's right. Get ready to up your fun with numerous physical and fun activities at Upbeat Center, located at number 11 Admiralty Road, Lekki Phase 1. For more information, visit upbeatcenter.com or call 0818 8844 991. Upbeat Center. Up your fun, up your life, up your fitness.
99.3 Nigeria Info, your number one station for talk. Let's talk.
It's 5:33. I'm Sandra Ezekwesili. How is Nigeria handling the war on COVID-19? Now, buying and receiving the vaccines is one thing, but after that, there's a question of administering the vaccines. Am I right? Who can Nigerians trust to ensure that the vaccines end up in the right arms? The government is saying, trust us and only us. In fact, the federal government has banned all private entities from administering COVID vaccines. The only entity that is allowed to do this for now is the National Primary Healthcare Development Agency. The government gave some reasons for this. First, vaccine rollout is a primary healthcare issue. So obviously, the National Primary Healthcare Development Agency should take the lead. Second, the government says it wants to be able to monitor all after effects of the vaccine. So it is better to have a single centralized body doing the vaccinating and keeping records and performing follow-up care. And thirdly, the government says it wants to ensure transparency so it can make sure the first phase of vaccination is reserved for priority persons like frontline medical workers and at-risk sick people. But as you can imagine, there are some critics of this plan. Some critics are saying that they doubt the capacity of the National Primary Healthcare Development Agency to handle the rollout. Some are saying that private sector should be included. But on the other hand, people are pointing to the COVID controversies and asking if the private sector even has the capacity. And then you have those who are saying that government should involve international aid agencies for the rollout, just like they did with the tail end of polio vaccination exercise. So you have groups like Rotary Club, Bill and Melinda Gates Foundation. You have people who are making that argument. Which group do you belong to? Do you think that the government, through the National Primary Healthcare Development Agency, can handle the vaccine administration across Nigeria? Or do you think they should involve other bodies? If you think they should involve other bodies, who should they involve? 0700-993-993-993. Share your thoughts with us via WhatsApp as well. WhatsApp is 080-959-75805. If you still want to talk about the squabble between BUA and COVID, be my guest. 0700-993-993. Just like the last caller said, I'm going to remember my New Year resolution for hard facts. So everybody gets 1 minute, 30 seconds. That's what you get. 1 minute, 30 seconds each for every single person. Emmanuel in Lekki, welcome.
Hello, Emmanuel.
Yes. Welcome, Emmanuel. Go ahead.
Thank you. I think it's better the government handles it for the purposes of the record. But my experience with normal vaccination. So let's say let's talk of rotatrix for children. I've seen that I've witnessed it where a nurse in the government hospital holds the vaccine and sell it at the private hospital.
I see.
So there's a serious need for partnership with other relevant agencies to ensure that these things are properly administered and they're not sold. There are cases where you see not for sale books at the bookstops. So, and these things have been managed by government agencies. But please, can you permit me to quickly talk about the previous BUA and
yes, please. Yes, please. Go ahead. You still have 20 seconds.
Yes, I think this is a problem. I think this is a society problem.
Okay.
And the reason why I said so is that imagine a family where their children will be chased out of school tomorrow if they don't pay school fees. And the husband cannot raise it due to one reason or the other, and then the wife pays. So this begs the question, is it the family that pays the money or the wife? So, and this one makes me to ask this question, what is the intention of COVID? And the reason why I say so is that if saving lives is their primary aim, who does what does not really matter. Because this is just 1 million out of 40 million, and you're already having problems. We have 39 million to still buy.
To go.
So if you really want to take glory, the BUA did not come and say, we bought all the vaccines. They said we bought 1 million. So if you want to take glory, buy 5 million, buy 10 million, buy 20 million. And that is when we will know that you really have the interest of the nations or are saving lives. So I'm beginning to also not advocate for them partnering with COVID because they are not showing through intentions that they really want to save people's lives.
Emmanuel, thank you very much for calling us. Gordon in Victoria Island, how are you? Hello, Gordon. Sorry about that. Call back if you can, all right? Hello? Call us back, 0700-993-993. Who do you think should roll out vaccine administration across Nigeria? Do you think it should be the National Primary Healthcare Development Agency? Or do you think the private sector should come in? Or do you think international aid agencies should be the ones who handle it? Or do you think it should be a collaboration between these three groups? And do you think that the government itself can handle it? Because government is saying, yes, we want to be the ones who do it. We are the only ones approved to do it for now because we want to monitor how it goes. We want to administer follow-up care. We want to have a single centralized body doing the vaccinating. We also want to keep records. Uche Nikorodu, welcome to the show.
Good evening.
Good evening.
Yes, first, just a quick one. A few weeks back, you had the session on apprenticeship, the Igbo boy system, and you said you were going to take down my detail and call me back. I haven't been expecting your call or calls from anybody. I haven't seen that.
It will come.
But to the point of today, just one thing first about the COVID controversy, who takes glory and who does not take. That just reveals the intention of the members of some members of the COVID coalition or whatever. It's why would they bring family issues to national platform? Bua and the other big man, there are issues about who wins a particular mining license in a particular place around Edo State. You know, that just tells you the average Nigerian mentality. It's to me, they should sort themselves out. If you want to do something for Nigerians, come out and do it. A previous caller said there are still 39 million doses to be acquired. If you want to take glory, do 39 and then every Nigerian will rise up and clap for you. Then for who administers the vaccine. For goodness sake, you and I know that the Nigerian health system does not have the capacity to do it. They don't have the capacity. Admit, get assistance from anywhere you can. The bottom line is that Nigerians should have the vaccines. Forget who does it. The government, we do not have that capacity. We do not have the capacity to do it. So restricting it to the government, primary health care agencies, even the basic ones they are doing, have they done it effectively?
Thank you, Uche, for calling us. Brighto in Ajah, welcome. Hello, Brighto.
Hello, Sandra.
Yes, how are you?
I'm fine. Good evening.
Good evening. Welcome. Go ahead.
You see, this issue of COVID, I don't know exactly what is their interest.
Okay.
Can you hear me?
I can hear you, yes. I can also hear your radio and the entire family, But thank you for calling. All right, Lagos, you're just tuning into the show. You're listening to Hard Facts on 99.3 Nigeria Info. I've told you about the controversy with BUA and COVID fighting about who paid for the first dose, the first million doses of COVID-19 vaccines. I just told you now that the government says Nigerians need to trust the government, the federal government only, to roll out the vaccines, to administer the vaccines. They've banned all private entities from administering COVID vaccines. The only entity allowed to do it is the National Primary Healthcare Development Agency. That's what we're talking about right now. They say the vaccine rollout is a primary healthcare issue, so NPHCDA should handle it. They've also said that they need to keep records of the people who have been vaccinated, so it's better to have a single centralized body doing the vaccinating. They also need to perform follow-up care, and they want to ensure transparency so that they can make sure that the first phase of vaccination is reserved for priority persons like medical workers and people who are at risk. I wonder if Chooks agrees that the federal government should do it by themselves. Hello, Chooks in Isolo.
Hello.
Thanks for calling us.
Thank you. Good afternoon, Sandra.
Good afternoon. Welcome. Go ahead.
I just want you to look this issue of COVID in this way. I think I was listening to Joyce this afternoon, and there's a way she explained things. BUA, they get this something at the rate of $3.04 or so. Then the Nigeria are saying they are getting it at $8 per a dose. So if you calculate the difference, I am believing maybe it's because of that difference that is making them to have this misunderstanding. It's not really who buy or who not buy. It's because of that difference of money. And when you look at when there is this difference is there, that's why so many people are sometimes saying the COVID is not real. Government is making money out of it.
I think you're talking about an entirely different thing from what we're talking about.
No. I'm not talking of a different something.
Because what I'm talking about is the vaccines that the BUA group claim they got they got through the African Union through COVID. They said COVID and CBN governor helped them make it happen. So the people who are making these things happen are Afrexim Bank and the AU, right? So you have the BUA saying that they brought out money because there was a deadline to buy the first 1 million doses. And the first 1 million doses cost about $3.4 million. And nobody else...
At the rate of $3.04 or so.
I don't know the breakdown for each vaccine.
I had it from the program of Joyce.
Okay, that's fine. But I'm focusing on what the two groups have said the problem is.
That's what I'm saying. the problem I'm believing is because of the difference. Maybe because almost $5 difference or $4 difference.
Okay, but if that were the issue, wouldn't Kakovi themselves mention it? Because they didn't mention it. Kakovi didn't mention that.
They won't mention that for you.
Okay. All right, Chooks, thank you very much for calling. Well, let me tell you, Lagos, that as of yesterday, Nigeria has confirmed 13 cases of the B117 strain of COVID-19, the strain that was first detected in the UK. So that's a sign that apart from community transmission, we also have new cases coming into the country from international level. On the plus side, the AstraZeneca vaccine is effective against B117. At least that's what the latest trials are showing. The vaccine is showing a 75% effectiveness against that particular strain. It's not as good as the 84% that it's shown against the original strain, but it's still effective enough. The real concern with AstraZeneca is the 501V2 strain. 501V2 strain. That's the one that was detected in South Africa. And the news that we're getting from trials is that AstraZeneca is performing poorly against it. We don't have the precise figures yet, and when we do, I'm going to give them to you. But the drug company is saying that it is not doing well in terms of stopping infection. But it seems to be doing okay at preventing serious symptoms and hospitalization. South Africa has paused its use of the vaccine for now. And we're hearing that AstraZeneca is already working on a way to improve the vaccine's performance against 501V2. Basically, they may end up creating a booster shot that people will take a few weeks or months after taking this one. Now, Nigeria has to pay attention to this because so far, a lot of the vaccine doses that we've been guaranteed are Oxford and AstraZeneca. I'm talking about both the shipment from the AU and the COVAX shipment. And now we have another major source for vaccines. And apart from that, the Ministry of Health says that Nigeria has struck a deal with Gamaleya, the Russian drug maker, to give us the Sputnik vaccines. At the most recent trial, Sputnik was over 90% effective. So as you can see, government appears to be pulling vaccines from different sources. What remains to be seen is how soon these vaccines can be delivered. We've been seeing production delays. We've been seeing supply delays worldwide. It's not just a Nigerian problem. Well, Nigeria is not producing any, but yeah, supply is a problem globally. Basically, everybody's trying to get the same product at the same time, right? Vaccine makers have never had to make these many doses of any drug this fast. So there are bound to be hiccups. And also with these new variants, it's now a race against time. It's that conversation I was having with, I forgot the name of the caller earlier on, about why they need to spend money on these vaccines now. Because of how quickly the vaccines are mutating. The more they spread from one person to another, the more the genetic makeup of the person it spreads to changes the virus. And then it moves to the next person and it becomes a new virus. And that's why we have various variants now. You know? It's a race to vaccinate enough of the world quickly enough to prevent the more resistant strains from spreading enough to mutate even more. But that's it. That's the update with vaccines. What do you think? What do you think about the entry of the B117 into Nigeria? What do you think about the mixed results for AstraZeneca? 0700-993-993-993. I've got awesome news coming out of Kaduna regarding oxygen. I'm going to tell you about that after I take two calls. You're listening to Hard Facts on 99.3 Nigeria Info. The number to call is 0700-993-993. Titi Lokwe is on the line. Hello, Titi Lokwe. Thank you for calling us. All right, we don't have the call just yet. Titi Lokwe, hello. Hello, thank you for calling.
Okay, taking Sandra.
Yes, welcome. Go ahead.
I was even speaking to myself. I thought I was speaking to you directly.
Oh, sorry. Go ahead. Say it again.
No problem. You hold me 30 seconds. That was in January. Yes.
Okay,
Hey,
take it now.
Sandra.
Take it now.
Sandra, number one, I am disappointed to be a Nigerian. I am disappointed. We have been debased. We have been reduced as a people. Number one, there was insecurity in the northeast. The Joint Task Force had to come in. That is the private militants there. I mean, the number two, there was Fulani bandits in the southwest and other parts. Well, until we had Sunday Igboho that stood up. Now we have a pandemic, and that COVID had to stand up for Nigeria. What is the responsibility of Nigerian government? What have we been doing with all the monies we have? How much have we been paying our politicians who don't care about the people? Welfare, education of the people is the primary responsibility of government, and we have to leave it to individuals. Whether you call them Kakobido, you call them businessmen, the caller before 5 o'clock, I mean before your break, he said it all. These people are businessmen, they are doing it to make their own money. Remember when the border was closed by Buhari? BUA, Dangote, they were crisscrossing ECOWAS, while other people were not doing that. That was an undue advantage. These people get a lot of incentives, businessmen now, from government, sometimes through most of the time through corruption. They make so much money, they rip up the system just to make you and I debase, to make us less important as human beings. If we had a serious government where system works efficiently for everybody, Nigeria as a country does not need to wait for people. Government will stand up and rise up to the occasion, and we won't have this kind of embarrassment.
Thank you for calling, Titi Lope. Olatunde is on the line. Olatunde, I've got 1 minute for you. Welcome. Olatunde isn't there anymore, but thank you for calling us anyway. Let's go to WhatsApp. We have a lot of comments on WhatsApp. Kevin from Shasha says, Sandra, I think BUA Group is allowing the ego of the African to take the better part of them. To the best of my knowledge, COVID has a central purse where monies are being contributed to by their members for their projects, which the public has never known who donated what or how much. If BUA Group paid for just the initial payment of 1 million doses out of 40 million through the same COVID, it's very wrong for BUA Group to go public with such publication, because it doesn't mean that other members of COVID refuse to make their own quota or will not contribute their quota to the procurement of remaining 39 million. All right, Kevin, let's take a break, Lagos.
Do you earn an income? Are you in need of funds for your child's school fees? Is your car or equipment old and needs a replacement? Do you need a loan for personal or business use? Whatever your business or personal need, CreditVille has got you covered. Simply dial 0805-510-0010. You can also send us an email via info@creditville.ng or log on to www.creditville.ng. CreditVille, financing you for a good life.
Lagos, you're listening to Hard Facts on 99.3 Nigeria Info. This is a part of the show where I give you 10,000 naira. Courtesy CreditVille. All you need to do is call me, answer as many questions as possible, and win. That's it. Call me, answer as many questions as possible, and win 10,000 naira for yourself. The score, the record to beat today. Hold on, let me take a look at my paper right in front of me. The record for you to beat today is 6. So I have 8 questions in front of me. You have to answer at least 7 of them correctly so that you can beat the person that answered on the sunny side, that answered 6 on the sunny side. Good luck to you. I hope that person becomes you. 0700-993-993-993. 0700 993-993-993. Hello.
Hello, good afternoon.
Good afternoon. Thanks for calling. What's your name?
My name is Shola.
Shola, when you win, stay on the line so we can get your details, all right?
Okay, ma'am.
What Nigerian company that claims to have paid 1 million COVID-19 vaccines?
What?
What's the hashtag for the protesters who don't want LCC to return to the Lekki toll gate?
Hashtag Defend Lagos.
Defend Lagos. Name one of the 2 hashtags for the protesters who are challenging the first protesters?
The two protesters, right?
Yes.
Hashtag they no body power.
Yes, that's correct. What's the hashtag for the ones who want to return to the toll gate?
No idea.
Okay. How many NINs did NIMC issue in December and January?
3,000.
3,000? Which regulator is being sued for putting restrictions on cryptocurrency?
CBN.
Which other regulator has previously recognized cryptocurrency?
FTD.
Say that again?
FTD.
Okay. Well, your time is up. Thank you so much for playing. Unfortunately, you didn't answer enough questions to be my winner for today. So thank you very much for calling, and congratulations to Lauren Shaw Abayomi, who's our winner today. Answered 6 questions on Sunny Side with Joyce. Let's listen again to our sponsors on this part of the show and then wrap things up.
Do you need to meet up your goals for the year? Then here's the good news. Goals are easily achieved by choosing Creditsville as a reliable credit assistance. Creditsville is accessible and reliable at all times. With Creditsville, interest rates are affordable, repayment plan is flexible, disbursement is processed within 24 hours. These and many more are the reasons why you should choose Creditsville as your accessible and reliable financial partner. For more information, log on to www.creditville.ng. You can also send us an email via info@creditville.ng, and you can give us a call on 080-5510-0010. Creditsville. Loans, investment, leasing.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.